Welcome to the Flower Lounge, a place for conversations with wildly creative people and a little plant-loving wisdom to help you experience life in full bloom. I'm Katie Hess, flower alchemist and founder of LOTUSWEI, and I believe in a world where we're all living at our personal edge. Welcome to the Flowerlounge Podcast. I'm very excited to be sitting across from Juliana Bishop. She is an old friend of mine, and she's also a practitioner that I've worked with for many, many years. She is a medical herbalist. She specializes in Chinese herbs as well as Western and Ayurvedic herbalism for over the last 12 years. And she's also an astrological counselor. So she works with people's astrological natal charts and has deep wisdom and knowledge around that whole topic. But today I really want to get into talking about Chinese herbs. If you've listened to this podcast before, you know I'm really enamored and interested in the whole medical system in the Far East that's been around for thousands and thousands of years. And I have personally worked with Juliana for many years. One of the reasons why I think she's so amazing is because not only does she have a really wide breadth and experience with Chinese and Western and Ayurvedic herbs, but she also makes her own formulas, which is just incredible. And they're tinctures, so it's so easy to take them. It's not like those piles of herbs you get in the paper bags, and then you have to go home and cook them up in a special way and get them to the right consistency. And then it's craziness, right? Is the old system. Not craziness, just not the most convenient. So Juliana makes these tinctures. You can throw them with you, take them with you, and they make serious impact in your health and wellness. Thank you for being with us.
Hi.
So if you don't already know and you haven't been to Phoenix yet, Juliana is one of the practitioners that we are so gung-ho about, that we so stand behind her work, that she's actually offering consultations and sessions out of our building here in Phoenix. So if any of you are coming to the Phoenix or you're in the Phoenix area, make sure you contact us, because we think everyone should have appointments with you, Juliana. So maybe just like a little quick overview for folks who don't know you of how you got into this field, and just like the kind of the speed train version of how you got to where you are now.
The background.
Yeah.
So I'm from upstate New York, and I grew up in the country. I didn't realize how good I had it until I moved out to Phoenix and realized a lot of people didn't have the plants to use and didn't know, that type of thing. And Arizona is full of medicinal plants. And so as I studied here, I went back to my roots and I learned that the plants that I was growing up with also were wonderful. And I remember them. I used to eat them.
Okay, segue, because we usually start out every episode and I forgot. I keep forgetting lately. We do this little exercise at the beginning. Let's do that right now, since you're talking about your childhood flowers, where you close your eyes and go back to a time in your childhood when you played around flowers or plants or trees. See if you can identify a favorite and reflect on the 3 words you would use to describe its personality. And then whenever you're ready, open your eyes and just tell us everything you're thinking about.
Red clover. So red clover, I love the color. Tastes really good. And it grew on the side of the road. So personality?
Yeah, how would you describe its personality?
Kind of like a cute little troll. I don't know. That's the first thing that came to my mind. And then when you pluck it, you taste the sweetness inside. And I never knew that it was that healing. So, and I would play with it. And my mother told us, we could eat it. And it's one of my favorites.
What's a troll?
Well, the hair, like the hair of a troll, it kind of looks like that, like the shape of it.
Right.
And it's a purpley red color.
Gotcha.
So that's the first thing I could think of.
Cute, little, sweet, healing.
Mm-hmm.
Okay, because what we find is that the way you describe your childhood favorite would typically describe the way in which you bring your greatest gifts into this world.
Wait, I bring what?
Your greatest gifts
Really?
into this world. So cute, cute little, sweet inside and healing. That's so cute. Okay, so yeah, so you had a lot of experience with plants growing up, and then you came to the desert.
I know. Yeah. I feel like I know the names of more plants here because I studied them. So my mother will tend to remind me what I grew up with. And I would say that's what started my path. And then I had my own health issues. And the first thing that, doctors did was put me on medication, but I was in high school. So I started off really, really young. And then I just had this gut feeling there's got to be another way, and I can't be on this stuff for the rest of my life. Slowly weaned myself off with the guidance of a doctor. And then I just started researching, and it wasn't going to be my major in school, but it became my major in school because I just kept on reading books, and I started a club of wellness.
You did?
Yes.
In high school?
Well, no, in college.
In college.
So I was going to go to grad school for school psychology, and I ended up coming out to Arizona and studying plants. Never thought I would do this for a full-time job, and I love it. So it just happened. And then as I help myself, I can help other people. And I almost never stop learning. So
can you talk a little bit about your first experience meeting your Chinese medicine teacher? Because I met her when I moved to Phoenix in early 2001. I met her. I think I succussed some jars of herbs there for like 1 week in January of 2001. I can't remember. Oh, I think because I got a regular job and then I couldn't volunteer as I needed to.
Yeah, so when I was in college, I took the Western Herb program, and in order to do that program, you need to study and do some outside like mentorship or internship. So I met my teacher doing that. And then as I worked around her, I realized I don't know enough. And she knew Eastern medicine, and that really just made everything work even more. So what I noticed was just using the Western herbs was similar to going to a doctor, but using natural things instead, so it was a natural way. So it still wasn't looking at the big picture of how the body works together and how there's patterns. And if we were to use one herb versus another, depending on that person, it would shift things, symptoms that don't even seem related. So when I studied with my teacher, I just knew I didn't know enough and I needed to study with her. So she took me on for 2.5 years, and I observed clinical and did pharmacy and learned all about the plants and studied pinyin names. And then I had my background
pinyin
too.
Meaning
Chinese
Mandarin
names.
Chinese.
Yeah. So, because you have to learn Latin names in school. So I just noticed how effective it was and the results that she had. It wasn't like going to Sprouts and just getting a supplement.
Oh, yeah. I totally understand what you're saying. Yeah. So when I got back from living out of the country in 2001 and worked in a health food store for a little while before I built up my practice, I had that same sense of like, wait, this is just kind of like Western medicine, only we're using supplements and vitamins, but it's like kind of a shot in the dark. And it's like, well, I have this symptom. Try this, right?
Yeah, just a natural version of it, like a natural Band-Aid.
Which is good. It's a step in the right direction. And I think it's because it's safe and there aren't any terrible side effects. It allows people the freedom to sort of self-discover and self-explore and try things. But discovering like this whole incredible thousands of years old philosophical, deep, profound, pinpointed scientific expression of Eastern medicine it's kind of like a whole other level, right?
It's a different way of thinking. It probably took me about a year before I could actually think Eastern medicine, even though I was studying it. I had no idea, like it didn't come together because I kept on trying to think like Western medicine, like what we're taught. And my teacher kept on trying to get me to think differently. And so once you get it, you get it. It's like, it just turns on and you're like, oh my gosh, all these patterns, if, again, they seem unrelated. So that's why I think some people don't get too far with what they're doing because they have one condition, they're working on that with medicine, and then they have another condition that doesn't seem related and starts to get too complex and all these medications. And where Chinese medicine looks at all of those symptoms, finds the pattern, and then it may be as simple as one formula that takes care of all those things.
Like 20 different symptoms.
Amazing. Yes. And even if one of those symptoms still pops up, then you have your natural band-aids. So what seems so complex is even more simple than what we think. And I think when my clients come see me, they're overwhelmed by everything that's going on with them physically. They've been sick and tired of how they feel. And then I just narrow it down, like, these are the few things that I need you to take a look at. And they're like, oh my gosh, and that makes so much sense why this is happening.
Mm-hmm.
So even just talking to somebody about, according to Eastern medicine, what's going on with them is enough to validate where they're at, instead of going, well, we don't know what's wrong with you, or this is what's wrong with you. And then they still have the symptoms.
Yeah,
So,
it's almost like it starts with like a little seed, right? And then there are all these little tendrils coming out. And if you're focusing on all the little tendrils and little rootlets and stuff coming out, which are the expression of the seed, it could be super overwhelming because you're like, I have 20 different things that are going wrong with me and I can't get a
what
handle
is going on?
Whereas you would look at it as like, come all the way back to that little seed.
Yeah.
And then get at the seed and then all those 20 things resolve themselves.
Yes.
So you were primarily with pulse and tongue diagnosis.
Yes. So in Chinese medicine and also in Ayurvedic medicine, they look at the tongue, which I heard that a long time ago, doctors used to have you, stick out your tongue and see what was going on. In Chinese medicine, Eastern medicine, they look at the coat and what color. Do you have little bumps on there, and it's really fun, especially with kids, because I ask them to stick out their tongue and they're like, I'm not sure if I should. I think I was told not to.
Will I get in trouble?
Will I get in trouble? So even sticking out your tongue and looking in the mirror, like, what's going on? Does it look like a nice pink color with a nice thin white coat, or is there no coat? Is it really red looking? I think that if you even start with that, you can see that maybe there's something off. And then the pulse, that just takes years to develop, and the sensitivity, and in Chinese medicine, you can see what the pattern is. So there's a couple different tools that we could use, as well as what are the things that are coming up. And we're asking tons of questions.
What's fascinating to me is thinking about the fact that you may also discover like a root pattern in 5 different individuals, but it's expressing itself in 5 different ways.
All different symptoms.
So there's like no way you can go at it from the symptoms. It's just so inefficient. It's better to go to that root pattern.
Yeah.
Because it could express itself in so many different ways in different people with different constitutions.
Yes. Yeah. So just recently I was talking to one of my students and she's like, I don't know how you do this. Like, this is complicated and overwhelmed. Like, there's so many things going on with this client. I just don't understand. And what I was taught early on was, okay, stop, getting caught up in all those little things. And it's kind of like foggy and confusing, like a whirlwind of stuff. What is showing up? What do you feel? So in the pulse, you can feel what's going on. And when you see on the tongue, that's giving you, that's there. That's what's going on, instead of confusing yourself with what Western medicine does, which is only looking at the symptoms, which can be so hard to,
So basically you're going to the root cause and you can see it immediately on the tongue and in the pulse.
Yes.
That's such a relief.
Great? And then they talk to you, and then that also confirms too. So, and you want to know all those things too. So, but if you can just go back to the basics, it's very simple.
Well, and then all the symptoms are actually really helpful for the patient, right? Because then they, we will be the ones to be able to say like, oh, this got better. Now I know that the herb is working for me because the symptom is better, which means that you've done a good job at identifying what the root pattern is that's creating that symptom.
Yeah, we usually, the second consult, go over all the things we talked about before. And it's amazing how much clients will forget.
Oh my God. I used to have that experience all the time when I was doing flower essence consultations.
Yeah. And then you're like, so how is this? And it's not what they came in for, but it was like on the side, they had night sweats or something. Oh my gosh, in 2 weeks, I haven't had night sweats.
I totally forgot about
I totally forgot, but I wasn't in for that, and that's really confirming, and that helps them. So I think that's the point of seeing somebody again, to following up how important that is versus again going to the a health food store and then just taking something and not having anybody to guide or work with you. I think that helps keep people motivated, so they're not, because you can be unsure, is this working or is it not working? And if you have the right person asking the right questions, you're like, it
Right.
solidifies. So that's helpful.
It's like having a wellness personal assistant almost. It's like
a coach.
Exactly. Like
Kind
a
of
support team.
Yeah, supporting you. Just recently, I had a client say, wow, I got to actually focus on myself today. Like, you're helping me actually make myself important. I think she's like a mom of 4 kids, and she takes care of so many different things. And she's like, I actually got to have somebody look at me and support me and say, these are the things that, if I were to do these things, I could take care of myself. And she was so grateful. And that was just, that meant a lot to me too, because I think that we don't get the support, and then we just run around and we do all these things. And at the last minute, now we're having the symptoms. It's even harder, So if we're to actually start taking care of ourselves, we could actually function more.
Let's talk about that a little bit. Let's talk about the power of working with Chinese medicine as a preventative versus if something's really wrong.
Right. So if something's really wrong, then you have possibly a couple different patterns going on. And then I have to decide where do we start first, right? It's not as simple. And then if you're preventing, you're still seeing patterns, but maybe you don't have a lot of symptoms of anything coming up for you. So you're feeling pretty healthy, but you're keeping yourself healthy and you're keeping yourself in balance. So there's a lot of formulations that will help everything work really well together. And even to the point where I like to think about this, that, in 20 years from now, I want to look young still. I want to look vibrant and healthy. If I know that these formulas can do that, if I start taking them now, why wouldn't I want to do that, right?
Mm-hmm.
So to keep my body healthy enough so that in 20 years from now, I still look vibrant and energetic and positive, and there's really great benefits. So some people will see me just for that. I need a health checkup. I want to make sure that I'm doing well, because I'm dumbfounded sometimes. I'm like, why are you here? Nothing's going on, right? Like in my mind, I'm going, you don't have anything major going on, but these people actually want to be proactive.
Mm-hmm.
So we work on that, and we have protocols for that. And what's a great way to eat? What's a great lifestyle that you can keep on doing those things and then, be playing tennis at 80? I have clients that do that.
Mm-hmm. Well, you might notice a subtle pattern in someone that it just simply hasn't manifested as an issue. That, say, maybe they're 25, maybe when they're 45, it will manifest in a way that if you look at it at 25, you can say, okay, here's this pattern. I wonder why this is. Oh, you have too much air. Are you eating at regular times during the day? No, I'm skipping meals. Okay, well, then it's something that you can kind of use as a map to redirect.
That's a really good point. Yeah. So what I've noticed is that a lot of people walk around and they don't have any symptoms, and they're young and they're feeling good and healthy. And it's not until later on that these things pop up, but they think that they're invincible. And if I were to look at their tongue ahead of time, I get their constitution. I can see what their tendency is for, like you shared. So say they have a red tip to their tongue, but they don't have any symptoms, then we can start clearing out heat in the heart, and then that will help them down the road. So maybe they're even more effective and they didn't even notice the difference.
Let's talk about Chinese herbs for mental, emotional stability. What can you tell us there? I think oftentimes we tend to think of Chinese herbs for physical conditions. What about, like mood and feeling calm and strengthened and nourished?
So with all the stress that we endure, just day-to-day stuff. So even if you don't feel stressed, our body is a barometer. So even women's menstrual cycles are a great tool. And when we have those mood imbalances, so say you're having a rough, frustrating day, and then it takes it over and over again to the extreme, and now you're feeling like something's wrong and something's off and I need support. A lot of people are running to get that support, and medication is definitely useful for people that need it. What's great about Chinese medicine is that it can help the body get into balance without necessarily the need for something outside of natural. So giving that a shot first. So the liver organ in Chinese medicine usually is the one that we want to work on when it comes to mood conditions. So it's really the center of things. It helps us with motivation, helps us to stay positive. If the liver's in balance, sometimes it can cause us to not feel settled. So, it leads into other conditions. So, just a few of the formulas that are very common are very successful in doing that and helping support people.
What about people who can't sleep? Usually when I teach workshops now, it's about 50% of the room can't sleep.
Isn't that amazing?
It's super amazing. I remember when I first started doing consultations almost 20 years ago, that wasn't even a topic of conversation. We weren't even talking about sleep at that point.
Right.
And now it's such a prevalent thing that people can't sleep at night. How would Chinese medicine describe that?
So there's a few different reasons why it would be happening. So you would have to decide what's going on with that person according to the tongue and pulse. What I've noticed though is just a good example with, that we feel energized at night or unsettled. So we just feel like we can't fall asleep and we're not settled enough into our body where we're feeling tired enough to sleep, or we're kind of on and our mind is racing. There's really great plants that are very relaxing and help us to get into that sleep pattern. Chinese medicine likes to focus on the different organ systems and patterns, so we would have to take a look at that. But you could do single plants that help to relax, versus over-the-counter stuff that wouldn't necessarily be safe or be more addictive. Does that help?
So you would say look at something in a more general format and say, okay, at least we could start drinking passion flower tea over popping a pill. And then the more sophisticated way would be to look at their tongue and pulse. Is it this person's heart? Is it their liver? Is it too much wind? Like what's creating the accelerated?
Right. Is the liver causing heat? Is it rising to the heart? It's hard to explain when you don't know Chinese medicine, but the culprits are usually, has to do with the heart, not the physical heart, but just the mind could be racing, the body feels unsettled. So we have to help that person to feel more grounded. If they have a racing mind, there's great herbs for that really help that. So there's amazing, isn't it? We could just use something that would help us naturally. So you said like 50% of people need this. I at times too will take passion flower and things that really help me to just settle in.
Yeah, for sure. 50% of people can't sleep. And then there are some, last time I checked, it was 1 in 5 Americans are on some kind of medication for mood. Do you see that in your patients? Are patients coming in with prescriptions? And what are you seeing? What are they, what are folks saying to you? I haven't been doing, with the exception of a few consultations that I did for like an Indiegogo campaign, I have been out of doing consulting work for many years now. So what's the climate like? What are people coming in saying?
Yes. So I see a lot of teenagers and young adults. And recently, a lot of people, it's about mood. They come in with severe mood conditions and they might be even medicated. And I'm seeing a lot of people medicated for it. And of course, I can work with that, you know. So it's a little frustrating because, it would have been nice to work with them before they were medicated to see if, we could work on the pattern first. But sometimes I'm handed the medication. Now I have to work on the pattern, if that makes sense.
Mm-hmm.
So I'm noticing it's something that's coming up a lot for people. And instead of helping that teenager work through things while taking safe, natural herbs to help them to do the same thing instead of the medication, they're easily just medicating. And then people don't understand, that emotions are important to release. And in Chinese medicine, it all is about releasing emotions and letting it go, not blocking it and
Suppressing it.
suppressing it, which I'm noticing is happening. So it's a lot easier to function in school when we suppress the emotions. And I understand that.
Temporarily, maybe.
Temporarily, we know that someday it's going to come out. So when I work with a client, it's about educating them too about how important it is to release those emotions and to not hold on to them. And what's great about the formulas is that they help you to release. So it helps you to release that chi stagnation in the body, and then they can still function. And then eventually at one point when they feel comfortable, working with their psychiatrist, they can go off their medication if they decide. So
Yeah.
yeah. And obviously there's a need for it at times. It's just, are we easily jumping to medication or instead of working through emotions and still working with other practitioners to help that?
In your opinion, you see particular medications being prescribed too often?
Yes, too often, and similar medications over and over again.
What types of side effects do you see, and does the being on that medication affect how you see the pattern display in the body?
So being on medication might affect the liver. I'm trying to think of what other things. A lot of the medication will increase serotonin. And if you're doing that, and then there's a lot of influx of people that are doing like Cbd oil and things that also increase the serotonin, which can be dangerous when you're combining and there's not enough information or instruction on that. So I'm seeing that too.
Tell me more about that. What's dangerous about that? Because I think folks are using CBD like
candy.
Yeah, and it's not well studied, like long-term effects. Tell me more about the serotonin.
So when you increase your serotonin, that's going to help your mood, right? So there are natural things that help that.
Like chocolate?
Yes, chocolate does help that. So it ties my hands at times. So now I'm asking every single client if they're doing marijuana CBD. Are they, do they have a card? That sort of thing. Because if they don't tell me that, then I can't, there's certain things that I can't combine with it because the thing that I suggest might increase serotonin.
What are the dangers of having
there's toxicity. So you can get really severe headaches. Mm-hmm. So just educating somebody on that. And what I've noticed is that there's medical doctors prescribing something for, like an antidepressant that increases serotonin. And then on the side, somebody's doing marijuana 3 or 6 times a day and they don't realize they're combining those two. So it's a little frustrating to see that.
Well, it sounds like there's a lack of education.
Right.
Around both the medications and legalization of marijuana and how those can affect each other.
Right. And knowing what they both do. And an herbalist has to understand what the plants do so that if somebody is on medication, that they're not combining the same action.
Right.
So that's really important. So I'm just seeing that over and over again. Because, a long time ago, a kid would come in and they wouldn't say that they're doing anything. It would be very rare. Now people still hesitate, but it's so much more common that there's a likelihood that that person would be doing something like that. So now I have to literally ask, even if they didn't write it.
Interesting.
So my feeling on it, so some people ask me, what my feeling is on it. It's not something I would do personally for myself. And I know it was around my generation that,
You're talking about marijuana.
Yeah. Uh-huh. But I have heard about good results, like people getting off of pain medication. That's amazing. So there's reasons for it. I think, like we talked about right in the beginning, like candy, some people are abusing it in a way by not knowing what they're on in combination. They're not talking to somebody who knows about these things. So
give us an example of one common formula, Chinese name, what's in it, what it does. Obviously not as a formula that everyone should take, right? Because it's very specific but just to kind of give us a feel for those people listening who have never taken a Chinese formula, for what kinds of things could be possible in just one formula.
Okay. So a very common one, they would call it jiao sang. And I use a modification. I don't use that one specifically, but just to name 3 herbs, because it's a very small formula. There's like maybe 5 or 7 herbs in it.
What's a big formula?
12 and maybe more. Sometimes I have 20 in front of me, it seems.
I love it. If you go to a consultation with Julianne, you'll see her with all of her graduated cylinders, which I love, measuring out all the milliliters of this herb and that herb and everything in a precise, obviously, dose into one bottle. That's so convenient to take.
Now, the reason for that, why there's so many in one formula, is because they all work together. So in Western herbal medicine, they tend to pick singles. In Chinese medicine, this herb does this does this complements this one. And at the end, just to protect the whole formula and that person, let's add one more thing in to help them digest it. So they really blend well. And constitutionally, if somebody's a hot person, you wouldn't give them hot herbs. Same thing with a cold person, wouldn't give them cold herbs. So Eastern medicine is really good about that. So in that one formula, 3 herbs that I can think of: bupleurum, angelica, which is dong quai, and peony. So bupleurum in Chinese medicine is really helpful for the liver. Angelica is great for the blood and moving the blood, building the blood. And peony is great for the spleen. And in Chinese medicine, the spleen transports and transforms fluids in the body and gets everything to move around, and also supports digestion. So those 3 main herbs is going to help harmonize the actions of the liver with the spleen, and then also on a blood level, move things around and nourish the body.
What does that mean in layperson's terms? Like nourishing all of those things, they're going to feel what? Or they won't feel what?
They're going to feel more motivated, at peace, more focused. If their body's being nourished on a blood level, they're going to get energy. They're not going to be as depleted. Their digestion's going to be, their bowel movements are going to be healthy, formed, nice dark brown color. So that's a really popular, nice blend. And the reason you wouldn't necessarily want to take it, because there's other ones out there that are even better, for that person over there. So that specific one is helpful, like I said, for those things, which I think a lot of us struggle with those things in Chinese medicine because of stress. Our digestion's off. We're not getting enough nourishment, and the liver is like tense and frustrated, and we're getting upset. So this formula just smooths all those things out.
Love it.
Yeah. So if you've ever been to an acupuncturist, they might have Jiao Sang, and there might be something better, so something that works better with your body, your constitution.
Can you give us just a really quick, like for folks who are at home, who have the capacity to just like pop their tongue out and look in the mirror? Because I know when we did our practitioner night, you were teaching people how to look at their own tongues with a little mirror. And I thought that was so sweet and cute. And like, how amazing would it be if we all taught our kids how to look at their tongues and we could help each other out? Like, hey, check out my tongue. Am I?
Yeah.
Can you just give us like I know it's complex, but like a kind of a general what we can look for in our tongues?
Yes. So some people I work with long distance, so I can't literally look at their tongue. So they have to, almost in a way, I'm training them to look at their tongue in the mirror as we're talking on the phone. So if you stick your tongue out, you're looking at the shape. Sometimes we have these little waves on the sides of our tongue that look like teeth marks. That's very popular. So I'll ask you if you have that.
What does that mean?
That means you're not absorbing that well. So in Chinese medicine, it has to do with the spleen again. So digestion.
Not absorbing nutrients.
Right. So a lot of us have that. The thin coat. So some people have a really thick coat. Sometimes the coat is a little bit off-white to yellow, maybe even a totally different color that we wouldn't necessarily see.
You got to check it like not after you've been drinking coffee.
Coffee would change the color. So knowing that we fast at night. So at nighttime, if you don't get up in the middle of the night to eat, right, we're fasting all night long. So in the morning, our tongue will naturally have more of a coat. That's probably not the time to look at it because it's just fasting. It's all this yucky stuff coming up and out. That's why some people will scrape their tongue. So once you eat, maybe wait a little bit longer as you clean out your mouth, look in the mirror, and you'll see whether or not it's a thin or a thick coat. If it's a thick coat, stuff's hanging out. Okay, so we want to scrape out that stuff and get your digestion to work a little bit more efficiently. If it's a nice thin coat, that's a good sign. If there's no coat, then we need to help you to nourish your body to get that coat. So coat's important.
Tongue coats.
Tongue coats.
Tongue coats.
Stick out your tongue. My favorite tongue coat looks like a frosted donut.
Whoa.
And that's very common when you're sick. So notice the next time when you got a cold, just stick out your tongue. If you see it looks kind of really frosted white, you are sick.
Scrape that baby.
If it's like that all the time, maybe we need to talk. And then if you see red, so if you see redder areas, sometimes people will see like a purpley color area. If it's really pale, those things are, things that you want to take a look at. We want to have a nice pinky red tongue. That means the blood's coming to our tongue. We're healthy. We're getting circulation. If it's too pale, we might not have enough blood, according to Chinese medicine. If it's very red, like a piece of meat, raw piece of meat, then in a sense we have a lot of heat going on, or it might be burning off, the nourishment that we do have in our bodies. So yeah, so it'd be fun.
Bumps?
The bumps, they're called papillae. So they can be white, pale, red. So sometimes that's congestion in the body, like dampness in the body, or sometimes it's excess heat. So it's telling you something, like something's off. It's not just inflamed taste buds, but it could be because if you just burnt your tongue. I had somebody ask me, they're like, is this normal? Did the formula do this? And then after a while, she's like, oh, I think I bit my tongue. And I'm like, yes, that happens.
And then the super bright red tip was the heart.
A lot of people have a little bit more red at the tip. And I think it's just in our culture, we think a lot. A lot of people in school who are studying a lot will have more energy there. Energy in Chinese medicine, like it's very active mind. So you'll see it at the tip. So it may not be anything, like there might not be any symptoms around it, but if you're having trouble sleeping at night and you're worrying and you're thinking all the time and your mind's very active and you really do want it to be a little bit more focused and grounded, then we would look at that area of your body and there's appropriate formulas for that.
I texted you kind of late last night and was like, hey, have you had any success stories with Bell's palsy? I have a friend who woke up with the left side of her face paralyzed. Can you help? And was kind of, I shouldn't be, but I was kind of stunned that both you and Kaya, the acupuncturist who works here as well, both of you had success stories. Can you give us like a quick bullet list of, stream of consciousness, as many kind of conditions that you've worked with successfully with Chinese herbs?
That's a good question. Yeah. So we talked about mood, all different mood conditions, skin. Wow. Like you can do a lot with that. Well, because people go to dermatologists and they're using creams.
They're getting all these like really strong medications that you can't be in the sun.
Right. Or burning warts off or, certain things that, and then they don't go away. So Chinese medicine is really great for that. Just common things that, if your sugar's off, if your blood pressure is a little bit elevated, cholesterol, the normal things that you would see somebody, in the health community for. Herbs have been traditionally used for those things for thousands of years. And so it really just depends on each person. We talked about sleep, so sleep, digestion. So there's a lot of people with digestive issues.
Food intolerances.
I know, all these allergies. I really don't think that this is just all of a sudden. I think that we have been struggling with allergies. It just wasn't in our society something that we were paying attention to. So now that we are paying attention to it,
It's everywhere.
yeah, and why not look at those things and help people? So I always ask how your bowel movements are. It's a funny question, but if you're pooing healthy, then it shows, that it's going well there. If you're having symptoms like constipation, diarrhea, loose stools, we know something's really off and you're not digesting. You're not getting the nutrients from your food, and then you don't get energy from that. And
I imagine you're seeing a lot of people also with period, PMS cramps, cysts, fibroids,
yeah.
reproductive issues.
Yeah, there's a great
hemorrhoids.
Yep, all different stages of life. Menstrual cycle is a valuable tool. And so people would rather do natural than be on birth control or hormones. Even women that are transitioning and going through menopause. I've had women that have been bleeding for weeks and weeks and weeks, and they come see me, and within days it stops. So profound and simple in a way. So it's not like we're doing anything
invasive.
Yeah, exactly.
You're working with the body.
I'm working with the body because something is not quite right, and due to stress, so we naturally transition, and that's a natural process. It's how you transition. So I have women that transition. Oh, I had no issues, no symptoms. That's what we want to hear. We don't want to be bleeding for days, And then there's a lot of people wondering if they're going through menopause and they're 45. And then their period starts up again, and now it's regular again, and they don't have the symptoms anymore. Oh my goodness, you might be able to go years without having, going through menopause. That's a good thing. Your body is healthy. It doesn't have to go in early. So it was just off and you were under stress during that time. So sometimes it stops us from going quickly into some next phase when we're not ready.
Love that. Talk about Chinese herbs and kids and pregnant moms.
Yes. So herbs can be very unsafe for pregnancy.
Mm-hmm.
So you have to be very careful. So part of my job is to do that. So I've worked with a lot of midwives, and when you're pregnant, a lot of moms don't want to take medication that maybe they were currently on. And with the permission of their doctor, of course, they decide, and they'll come see me, and we can work with the body and use very safe formulas. And then post pregnancy, so that when they're going through like those emotional shifts because of their hormones, their nursing, there's many things that we can do with that. And then the babies, and then toddlers and kids. So it's very effective. It's amazing. Like you almost need to use half the formula, like the dosage, because kids are so, they just take it in. They haven't been influenced by a lot of chemicals and things that we've put in our body over the years like adults have. So,
and when you say half the dosage, you don't mean half the dosage because they're half your weight. You mean even when you've adjusted it to what should be the appropriate dosage for their weight, it's still not as much as they would need because they're so sensitive and receptive.
It works really like more effective. It's very quick. So for a kiddo, it's going to be even quicker, where sometimes we need the full 2 weeks, to really get things going in our body. And, it's like, okay, this is a new thing that you want me to do. All right, I'll do it. Where kids are like, yay, and things just shift, which is great to see.
So you see your patients about every 2 weeks?
So yes, in the beginning, every 2 weeks. That way you have time for your body to adjust. And then I can do the tongue and pulse assessment again to see what has changed, what still needs to be worked on. Do we need to tweak the formula?
And what's the typical amount of time that you see folks? Like, do you have some people who have been coming to see you for many, many years consistently, or are some folks after 6 months, things are resolved and they no longer need to take herbs? What's your average relationship like with your patients?
So I have both. I have people that I've seen since my first office back 10 years ago. Maybe they get refills. Maybe they come in just every now and then because instead of going to a doctor, they want to do something natural. And then it's only for a month that they need to see me.
Yeah.
There's people with chronic conditions where it may take several months. I would say the first couple months are the most important. And then after that, some people are just on a maintenance. And then we just follow up. They pick up their formulas. Hey, maybe we should do, just a check to see if we need to modify anything because you've been doing this for 2 months. So it just depends on each person. And other people, like, I had a child for childhood, warts come in and they cleared away in a month. I don't need to see them. we're done, So if he needs help down the road, he can come back when he's older.
It's so easy.
Yeah. So some people, it's a shorter period of time, and other people, they just love to have that as an option that they can use. I had one gentleman come in and just recently, and it had been a couple years since I had heard from him. And he's like, remember, you just gave me these 2 formulas. I was out the door and it was fixed. And I'm like, oh, okay. He's like, can you do that again? So it just depends on what you're coming in for too.
It's hard when you don't see them again, because sometimes you don't get to hear the success stories. You just don't see them. They don't come again. And
I know.
It's so nice to later find out that
2 years later, I'm like, and he's still bringing the same bottles that I gave him.
That's so great.
I love it.
So you're going to be on the podcast as a regular guest, and I can't wait to talk to you next time about astrology.
Yeah.
And also to ask you more in-depth questions about your teacher training apprentice program, in case there are any folks out there who really want to dig deep into Chinese herbs. But for now, what would be, as the last question, do you have any words of wisdom or advice you often find yourself giving people, or just something that kind of springs organically to your heart in this moment to share?
I would say consider looking at natural options, because you can feel better and happier. And if that doesn't work, obviously there's other things, but consider it. It's just a passion of mine, and it's been really helpful, and I've seen amazing things happen.
Consider it first before you exhaust all the other options, right?
Yes.
Try it first.
Yes. So I hope that helps.
Thank you so much for being with us.
Thanks for having me.
Looking forward to more, Juliana.
Yes.
Thank you so much for listening to The Flower Lounge. I'm Katie Hess, and we'll be releasing a new podcast every Wednesday. If you like what you heard, or you know someone who might be touched by our conversation, share it with them. And don't forget to subscribe. To find out what your favorite flowers mean about you, take the quiz at LOTUSWEI.com.